Okay, so this is for the patient Jane that we did the key assessment, parts one and part two for. So a little bit about Jane. She is 14 years old. She's a female. She was referred to the dietitian nutritionist by her primary care physician for weight management counseling. She is already falls within the BMI category of overweight. Her she is having a weight increase of 10 to 15 pounds every year for the last 6 years, and now her BMI percentile has progressed to the obese category for her age. Jane's environment. So she does live at home with her parents, given that she is 14. She has two younger siblings. Both of her parents struggle with weight. So her mom has hyperlipidemia and obesity. Her dad also has obesity and he has type 2 diabetes. Both parents said that they don't have enough money for food each month during the interview. And then I did in my key assessment part one, the paper, I went into some possible solutions. And even if they aren't, long-term solutions, they're just resources for them to use to get, where they need to be financially. But things like food banks, the summer food service program, and SNAP does help low-income families with nutrition and food assistance that they could definitely utilize. The role of the environment. So the parents typically introduce the child to foods and dietary habits. This is usually seen through modeling how to eat, also, giving the child food options that are healthy, such as like fruits, vegetables, high fiber snacks, low fat dairy products. Also, a child's social environment is one of the most proximal influence on his or her weight status and weight related behaviors, both dietary patterns and physical activity. So, this really does continue to stress the idea that the home environment can really make or break a child's and teens, dietary habits and their outlooks on health and physical activity and stuff along those lines. Also, there is a big push not to tell a kid, no, you can't have sodas. No, you can't have certain items, because whenever you tell a kid no, it seems to, even teens, it seems to make them want that item that much more. So, when you tell a kid no and never, you can never have Cokes, it just leads to a lot of bad things. The role of genetics. So, we've only scratched the surface of the genetic information we have pertaining to obesity, especially in children and teens. But there is genetic testing that determines the chances of obesity. And that's due to our technological advances that allow us to track the loci for obesity and related traits, which is very informative. So just looking at her lab values, we see her sodium is within range. Her potassium looks good. Her fasting glucose is a little high, so 100 to 125 milligrams would indicate that she is in the prediabetes section. So that's kind of where she's fallen right now, which is, definitely something to consider. And then her cholesterol overall is, fine. And then you look at her HDL cholesterol, and that is a little low, which is due to diet and obesity. This can cause plaque in her arteries, which can later lead to heart disease. And then her LDL, which is I guess, known as the bad cholesterol, is actually a little high. So this is again due to her diet, probably her lack of exercise, being overweight, things like that. So speaking about her weight and those factors, we'll talk about her BMI. So she right now is at 28, which does put her in that overweight category. Her BMI percentile of the 95.4 percentile does put her in the obese category, though. So this means that her BMI is greater than 95.4% of 14-year-old girls her age, which is very significant. And her weight for age comes in at 91%. So her current dietary habits, when we look at those, she's eating on average 3,000 calories a day. For somebody her age and being a female, she should aim for around 1,800. If she does become more active, let's say she gets involved in a sport or, just something where she's moving more, this can allow her to take in up to 2,400 calories. Um, so currently with her diet from the 3-day meal plan that was given to us, she was consuming almost double and sometimes triple the amount of sodium per day, which is 2,300 milligrams per day. So she was consuming, 2 or 3 times that. And then she also was consuming double the amount of fat intake per day. And this was not coming from good fat sources either. This was coming from processed foods, fast food. So it's not like she was getting, polyunsaturated fats and monounsaturated fats. She was getting saturated fats mostly. And then a lot of her vitamins and minerals, many of them were falling well below half of the daily intake that she needs. So this is, again, due to her consumption of the processed foods. They just don't have lots of vitamin A and vitamin D and all these vitamins and minerals that we need. So it was kind of expected with her after reading her 3-day food diary. So obesity in childhood does come with consequences. So you have physical consequences, of course, which would be the increased risk of hypertension, hyperlipidemia, diabetes. It even affects sleep. And then obesity is also linked to PCOS in females. So that's also something that could develop in her 20s and 30s as well, if it continues. And then social consequences such as bullying, stigmas, her experiencing a low quality of life. And then also there's research out there that indicates that unfortunately, like obesity, even in childhood when they get their first jobs, it can influence those things and later in life. So that's unfortunate, but it does happen. And then psychosocial, so the low self-esteem, anxiety, depression, these are all things that can come with obesity in adolescence. So I've just listed out a couple of the management strategies that I talked about in my paper. So, even though she's not a small child, they do recommend for small children reduce screen time to 2 hours or less a day. I definitely think with, social media and stuff, it can cause you to live a very sedentary lifestyle. So aiming to only sit on your phone for 2 hours a day or watch TV for 2 hours a day is it's a very challenging goal for teens, but it's definitely attainable. This would just allow her to get moving more, honestly.